University of Otago, and she has been the Vice President of the World Confederation of Physiotherapy from 2015 to 2019. She is an honorary fellow and honorary life member of Physiotherapy New Zealand and is also a fellow of the New Zealand College of Physiotherapy. She is a very well experienced researcher with 27 years of experience, and Dr. Margot is involved in research on interprofessional education, global health and physiotherapy and respiratory medicine, as well as obstructive sleep apnea management. She has 57 journal articles and 164 conference proceedings to her credit. Over to you, Dr. Skinner.
Good afternoon. Thank you very much for that introduction, and a very big thank you to the Dean of KDU, to Amara Perida for inviting me, and also to the Vice Chancellor. It's lovely to be back in Sri Lanka. I'm privileged to have been here before. And I think what I need to say about the topic that I'm about to talk about is that if we don't reduce the impact of non-communicable diseases, then we're not going to have people living long enough to enjoy the artificial intelligence. So we need to think about well-being and health in order for us to be able to enjoy all of the new inventions that are coming up. We need to put the health into a social context, and the United Nations Sustainable Development Goals have 17 goals that are there to save our world. The particular goal that I suppose all of us here are interested in is goal number 3, which is to ensure healthy lives and promote well-being for all people of all ages all around the world. I think that if we look at the other 16 goals, so health professionals have a role and responsibility in just about all of them, in terms of sustainability, the impact of climate change, all the other goals that are there, but the one that's particularly of interest is good health and well-being. There's some recent data that came out just a few weeks ago that have given reports on how well each of the countries that belong to WHO are actually doing in regard to progress with the SDGs. And you can see here that Sri Lanka is mediocre. It's just doing a little better than the other countries in the region, but there's still a long way to go. So a fairly average performance. So I challenge you to try and do better over the next coming years before 2030 comes around. So here's another illustration of where you're doing well in terms of some of the goals and where you need to perform better, and in fact where you've sometimes gone a little bit backwards rather than forwards. So I challenge you to take responsibility as health professionals to assist your country to move forward with meeting the targets for the SDGs. If we look around your country and we think of it in the context of the World Health Organization, WHO is actually working or collaborating with your country to set an agenda to improve the health and well-being of your country people. The disease burden in Sri Lanka has shifted. I think all of you know that it shifted from a focus on communicable diseases to non-communicable diseases. And these now are the leading cause of morbidity and mortality in your country. They're also the leading cause of morbidity and mortality around the world. So the particular priorities that WHO has set to work with in cooperation with Sri Lanka include cancer, chronic kidney diseases and mental health, as well as road traffic injuries. So we know that our first speaker was talking about road traffic injuries in your country. So hopefully there will be some positive change in regard to the government taking some more responsibility there. Let's have a look at non-communicable diseases and the particular data that relate to Sri Lanka. There are 4 key non-communicable diseases, or we could actually call them diseases of lifestyle, because they are able to be reversed. All of us can have some responsibility to make a change in terms of the NCDs. But the biggest one is cardiovascular disease, followed by cancers, chronic respiratory diseases, and that includes asthma as well, and also diabetes. So these are the 4 top causes of mortality in the country. And 83% of deaths in Sri Lanka are related to NCDs. So millions of people around the world and in your country, mortality is caused by NCDs. Your country is now in the middle income bracket, so it's moving out of the lower income, but we do know that the higher number of NCDs are the higher causes of death in the lower to middle income countries. One of the biggest things that you can do to turn those morbidity statistics around is to reduce smoking, and to particularly reduce the amount of smoking that is happening in your male population. There's a very high level of men in your country who are still smoking, and tobacco smoking is one of the major underlying factors that is causing cardiovascular disease, pulmonary disease, cancer, etc. So here's a challenge for you in terms of tobacco smoking. Raised blood pressure and obesity are also other key factors that are contributing to the data. So we don't only have a responsibility for our own health, but also the health of the people that you're working with. If we go back to the international scene for a moment, through our International Physiotherapy Organisation, the World Confederation for Physical Therapy, we recognise that the incidence of NCDs poses a burden on individuals, societies and health systems, that we need to put in measurements to reduce the NCD risk, and we recognise that because they affect all populations, there is a major role for us in helping people to understand health and well-being and helping to prevent NCDs and reduce the risk factors. So we have a policy statement that says that we're equipped through our education to meet the needs of people with or at risk of NCDs by providing evidence-based interventions that can reduce the incidence of NCDs and associated morbidity and disability. So we want to provide primary and secondary prevention programs, promote health and quality of life, and improve and maintain physical activity levels and functional independence. Those are key things that are part of the role of the physiotherapist. We're no longer in the business of just focusing on the ankle injury from the sports, obtained on the sports field, or the shoulder problem obtained through a work injury. We're interested in looking at the person as a whole, and one of our responsibilities when we assess a patient is to assess the whole patient, and if they are a smoker and if they are obese, when they've come in with their knee injury or their ankle injury, then we need to address the obesity and the smoking problems as well. So we prescribe exercise and physical activity, which is low cost. It doesn't cost a lot to walk in the park or walk down the road or walk up a hill. We advise on appropriate and effective physical activity programs for individuals as well as targeted populations, and the particular targeted populations are the elderly, because the numbers of elderly people are increasing in your country, and also people with disability, including intellectual disability. We know now that many of the children with cerebral palsy, for example, are not doing as well as they should because they're physically inactive. So many of the physiotherapists working with children with CP are now much more involved in active programs with those children, so that they too actually put demand on their cardiovascular system and become fitter from a cardiovascular perspective. So as physiotherapists, and also for all of the health professionals we work alongside, we need to advocate for sufficient resources to be allocated so that we can work to help prevent and treat these NCDs. So in doing that, we need to look at what we can do as health professionals. Part of our responsibility is to support national policies and programs and services and systems that enable the opportunity for services to be delivered effectively to people with NCDs. So one of the things that should be a driver in your country is to actively work with the politicians and the people in the Ministry of Health to support them in terms of where the money is being allocated and to identify the opportunity for more health prevention programs and more opportunities in the communities rather than having everybody come to a hospital for an outpatient appointment. We need to all be involved in the development and delivery of evidence-based, affordable, cost-effective and population-wide physical activity programs. So if you're the pharmacist, you can advise the patient to be seen by the physiotherapist, and the physiotherapist can advise the patient to be seen by the dietitian, so that we work collaboratively together and that we're supporting each other in social education and community service development. We also need to advocate our researchers to contribute to the understanding of effective interventions and cost-effective interventions that are going to be preventative rather than treating the person at the end of the road. So our children need to be educated in schools. We need to be in there as health professionals, providing advice to teachers and to the children directly so that they learn from a young age about healthy living. We also need to be more involved in the development and implementation of national plans for non-communicable diseases. How many people in this room are on any national advisory committees for health and well-being or in relation to expenditure of health monies? No one? Okay, so there's a challenge for you. We all need to be there. It's not just senior medical colleagues, it's not just people in the ministries that make the decisions. We need to be working with community organisations. We need to have a voice ourselves and speak on behalf of our patients and be advocates for them. So we also need to advocate for public policies and practices that empower the individual, empower the family, and empower the community to make healthy food choices. We also need to support the global initiatives on non-communicable diseases to emphasise the need for more efficient services. The level of physical inactivity in your country is getting to be an embarrassing level. The World Health Organization guidelines say that 150 minutes per week of aerobic exercise is required by every adult, plus 2 days of strengthening exercises. And I don't think there'd be a lot of people in this room who actually meet those guidelines. So if we as health professionals are not meeting the guidelines, how can we advocate those guidelines for our patients? So we need to support each other and work interprofessionally and collaboratively to provide person-centred services to enable prevention and management of NCDs. The power of the voice of the combined group is much stronger than the voice of one profession. We can also look at the best evidence for prevention and management of NCDs, and we can utilise the databases that the World Health Organization has, for example, and other evidence-based literature on clinical and cost-effective interventions. The data are there. We need to work with our health economists to look at the cost of a hospital bed stay and see how we can help to prevent our patients from having an extra night in hospital. Think about funding sources for research that relates in particular for physiotherapy to the efficacy of physical activity and being fitter and helping with prevention and management of LCDs. And for our students, we need to educate them to be able to be advocates for healthy living with the people that they're going to be seeing in the future. So Movement for Health is one of the mottos that our international organisation Physiotherapy has. And every year on the 8th of September we celebrate World Physical Therapy Day. And so I was privileged to be able to help celebrate that here in Sri Lanka the other day. But it doesn't matter what age you are, what level of ability you've got, or whether you are working in a community setting or not, there is an opportunity for us all to be more active and to take more responsibility for our own health. One of the ways that we do that internationally within our association is through WCPT linking with the other health professions through the World Health Professions Alliance. So the international associations of physiotherapy, medicine, nursing, dentistry and pharmacy have a collaborative agreement where we actually have a much stronger voice at the World Health Organization. Each of us is able to speak at WHO, but when we combine our efforts together, it makes a difference so that we have over 27 million health professionals that are represented by that voice at WHO. And it's actually had quite a powerful impact on some of the policies and procedures that the WHO has. One of the benefits of this interprofessional collaboration is to improve service coordination, to make more involvement for patients and families in decision making. So this has come out of some of the recommendations that our groups have had. A more coordinated and safe health system that's responsive to the needs of populations, no matter which country we're talking about. Focusing on more efficient use of resources, and particularly reducing the incidence and prevalence of disability related to these non-communicable diseases that we've looked into. And the research data that's come out of these sorts of collaborations very clearly supports the cost effectiveness of health professions working collaboratively, and also for the health professionals themselves. There is a reduced burnout effect, which is obviously good and a positive thing for us. One of the things that we've developed, which is available through the WHPA website, is a health improvement card, which any health professional can use with their patients. The patient, in combination with the health professional, will tick the boxes relating to the questions that relate to their diet and to smoking and their physical activity, and then can get a score to see where they rank in terms of their risk for non-communicable diseases. And now that we're in the computer age and we're looking at AI and things like that, we've actually got an app that's available to be downloaded so that people can use the app and make their own decisions about tracking their health score and knowing how they should take some responsibility for improving their own health. But unless we educate people about the need for healthy living, they're not necessarily going to comply with any exercise or dietary suggestions that we make for them. So we have a strong role as health professionals in managing NCDs, and as I illustrated before, for your community in Sri Lanka, with the very high level of cardiovascular disease that you have, cancers and respiratory disease, we need to look at more modification of physical activity, so being more physically active rather than physically inactive, pushing the smoking cessation, looking at sleep health. How well are people sleeping? How many hours are they getting? How disturbed is the sleep? And if people are having a particular sleep health problem, which is called obstructive sleep apnea, then providing some opportunity for those people to get help, because that also is associated with high blood pressure. The other things relate to obesity, nutrition, and for the children, asthma is one of the highest non-communicable diseases that affects children, or the respiratory disease affecting children. It's underdiagnosed and undermanaged, and there are too many children that spend time away from school because their asthma is not well controlled. So these are all things that we could work collaboratively with to try to improve in terms of outcomes for health. One of the things in relation to smoking cessation specifically is to give the ABC to our patients. So we need to ask them, and we need to ask every patient about their smoking status, give them brief advice about why it's relevant to stop smoking, and then strongly encourage the people to undertake some cessation support. And I know your government has actually got some policies in relation to smoking cessation, and I know that you can buy cinnamon-tainted toothpicks that will help to be used instead of smoking a cigarette. You can put the toothpick in, and that can be an alternative for smoking cessation. So anything that is innovative that will help the population to reduce the risk of smoking is important, because the evidence is clear that the more times a person is offered smoking cessation advice, the more likely they are to quit. So just again in summary then, the 10 top causes of death in Sri Lanka relate to non-communicable diseases. These data are available on the World Health Organization website and are updated very regularly with the data that come from your Ministry of Health. There's been a lot of media attention in Sri Lanka on smoking cessation, so it's not something that is hidden. It's actually out there, and the government and others are actively campaigning to promote smoking cessation. We know that tobacco use is still high amongst the male population and even amongst younger people, so the data are there. There's no hiding from it. And there are all sorts of fact sheets available. This one is one that was published by the World Health Organization and your country on heart disease and stroke, and the commonest way to get heart disease and potentially to have stroke is because you smoke cigarettes. So the challenges are there for the population to turn around the health and reduce the risk of these sorts of diseases. Is part of this illustration on the chart. Preventing people from starting tobacco use is really important, and the other thing is the second-hand smoke. For pregnant women and for children, to be around people who are smoking is also has negative consequences on their health. So physical inactivity is the other thing besides smoking cessation that we should all be aware of and all be focusing on. So we need to raise awareness about the importance and benefits of physical activity. We need to build capacity amongst individuals to develop local programs and maybe have parks in our treat areas for adults to undertake exercise, not just for parks for children, but many countries are now developing parks for adults as well. And give recognition and awards to individuals who are living healthy lifestyles and engaging in regular physical activity, and encourage others to do so as well. Coming back to the sleep health, it's important that as health professionals we're asking our patients about excessive daytime snoring and excessive daytime sleepiness and loud snoring, and potentially episodes of breathing cessation. These things are not normal, but they are treatable. But again, many people don't seek the necessary support, and so it's underdiagnosed and undertreated. And this is just some detail about how obstructive sleep apnea can actually be treated. And if it's treated, then the hypertension that's associated with it can also reduce, is also associated with reduction if the people become more physically active. It's already, the data are available in your country for the number of patients with obstructive sleep apnea and its prevalence. So again, it is underdiagnosed, it is undertreated, and could make a difference to people if it isn't recognised. So in summary, health professionals have a major role in improving the outcomes of non-communicable diseases. NCDs are increasing everywhere in the world. In every country, populations are becoming more inactive, and children are becoming more obese, and associated obesity in adults and also diabetes are linked to many of the mortality and morbidity statistics. So we have a major input into improving global health through preventive education and innovative and interventional therapies, as well as our role in getting in to have a voice at where the funding is and where the money is spent at administration and policy levels. There is a high level of evidence that physical rehabilitation has a positive benefit on quality of life for all people with NCDs. And this also includes people with mental health problems, which again is another major increase in all of our countries around the world. So new discoveries through research are always being made, so it's important to keep up with the evidence base and to keep being challenged by the data that come forward. Thank you very much for your attention.
Thank you, Dr. Skinner, for your interesting presentation. It's open for discussion. If you have any questions, you can direct to Dr. Skinner.
For NCD, physical inactivity, and sleep what I'm told factors, but I'm asking, is there any correlation between physical inactivity and sleep health?
Yes, there is. Many people who have sleep problems also are obese or overweight, and so physical activity can help with reducing the weight problem, but it also